are you aware of perhaps what the average Manx woman spends on sanitary products in a year?
Well, actually, the cost of sanitary products can vary. So you have everything from the own brand stuff that works out at roughly around about 66p a pack, all the way up to the sort of the bigger brands that are normally around about £3 a pack. So the average cost per sanitary towel can be between 6p and 14p per sanitary towel. And obviously different women have different menstrual cycles as well, so you can't really come up with an average as to how many they use over a year, because that will depend upon their own personal situation.
And have your department sort of conducted research into how prevalent this idea or this notion of period poverty is on the island?
Well, I think period poverty links again back to income poverty, and I think the way that you tackle period poverty and other types of poverty as well is by tackling the source, and the source is the overall income poverty. We could all come up with various different schemes that will tackle individual elements, but that doesn't resolve the core problem, and the core problem is income poverty, and that is where it needs to be tackled at its heart.
So the motion from the British Medical Association sort of looked to lobby government on like a general sort of universal free provision of sanitary products. But one of the starting points was perhaps rolling it out in schools. And also targeting inpatients at hospitals. Obviously, from a healthcare point of view, a bed, food, even toilet roll, these are givens, these are necessities provided and cared for by staff and by the hospital. But for the inpatient women on their cycle, are they expected to bring in their own sanitary items?
Well, this is something I think that's very important to be looked at. Again, obviously, there is provision available. Nobody's going to be left in the hospital without provision. So, I want to squash that straight away. There's not going to be anyone there who hasn't brought their own sanitary towels in, who is suddenly told, no, you've got a problem. That doesn't happen. But I think that you mentioned there about schools, colleges, the Scottish Parliament itself has rolled it out in the Scottish Parliament building. Now, I think those sort of things, they do have merit, and that is something we could look at over here. But as I pointed out, when you say about the British Medical Association saying about providing it free across the board, just to give the example of the cost I gave before, just to tackle those females in income poverty in Scotland, that 500,000 of the Scottish Government would have to increase to 13.6 million, and that's only the 19% in income poverty. So if you were talking the way the BMA is talking about taking it to 100% of the population, if you think what the cost would then calculate up as, and that would be the same in England, Wales. So while it is a very worthwhile cause that the BMA is fighting, and they have some very valid points, I think in terms of funding arrangements, it's just not really practical.
Yes, it's not feasible on the island.
I don't think so. And again, I go back to the point that the projects that are being run in Scotland are third sector led. So although the Scottish Government funding going into it, it's not Scottish Government led, and they are using a huge third sector organisation in terms of Fair Share that, as I gave the stats before, operates in thousands of places. They have 21 regional hubs Fair Share across the UK. We don't have third sector organisations on the island that we are able to partner with on that same sort of demand-led basis, and we don't have the buy-in to the wholesale suppliers either.
But that £500,000 grant from the Scottish Government, I think Fair Share we've identified potentially reaching 19,000 women. Could you not partner up with perhaps, the homeless charity GRI? You've got the food banks, the Salvation Army. Could you not use these as distributors?
You could, but again, you've got to source the products, and that is the key point. The Fair Share has the feed-ins to the distributors and large wholesalers, so they are able to get the products because of the mass they are buying on at a much reduced price. We don't have necessarily that same ability. But also, again, you pointed out it's 18,800 women that the new pilot across Scotland will actually reach. But again, just to put that into context, that's 0.7% of the female population in Scotland, and it's 3.7% of those women that are in income poverty or classed as being in income poverty in Scotland. So it's still not reaching. So although 18,800 sounds a large number in terms of the Isle of Man, when you break it down the figures and you look at the percentages, you are still reaching, even with that project, a very, very small cohort of those that they're wanting to help.
So we got obviously two men talking about potentially what's quite a taboo subject. But for example, we talked about schools before, and if there was access and provision in schools, and if women on the island or young women on the island had this sort of access to these products, do you think, particularly targeting the schools, it would remove the stigma and allow a bit of dialogue, and perhaps it wouldn't create so much of a taboo?
I think we can always be hopeful that that would be the case. But one of the interesting things, going back to the Scottish model again, which we've been talking about, one of the things that came out of the Aberdeen pilot is they asked all those participating to complete just short surveys. And they were going no further than the pilot. They weren't going to use a lot of the statistics. And they said there was a real reluctance from women to fill out a lot of the parts of the surveys. About 3/4 of every survey that came back was left blank, and a lot of it's one of those things that, as with a lot of things in healthcare, people don't like to particularly talk about. I think it is something that we do need to talk about, and as I say, in relation to income poverty, I think that should be tackled at its heart rather than just picking off individual topics. But period poverty for women is a very serious matter, and it's something that people shouldn't be going through.